to really utilize that. The other one was really, as has already been highlighted, the gap between the policies and the practice. Has already been highlighted, many of the countries have policies on aging, on older people, on care, which really do emphasize aging, but actually, when you get down to there are substantial gaps, so really key. Final one, and is obviously going to be discussed later, is really how to develop integrated services and care. This is so important. It's already been highlighted. There are many different agencies and service providers providing fantastic services, but how to integrate them, how to build services to really ensure that the support that older people need from health and social services is there. Is still a lot of work to be done. And some of the most interesting discussions we had was really on how to capitalize technology in long-term care. How can technology be used to really leapfrog in the design of systems and really, really empower older people, but they need for planning and monitoring and so forth. So those are some of the key challenges. So based on that, we sort of highlighted 10 key priorities for moving forward. Next slide, please. And this is a sort of real joint stakeholder work needs to be done to take these 10 steps forward. So obviously the key one really is to build that continuum of long-term care services, systems and services across the continuum with a strong focus on home and community-based, to be supplemented by residential, especially many of the residential services in the region are largely focused on providing shelter, but actually are not capacitated yet to be able to provide proper care services. Previous slide, please. Obviously, been highlighted the need to integrate long-term care with health and social support services and really focusing on that integration at the primary care level, but also highlighting the need to build up the skills and experience for complex care issues. Many of the stakeholders we talked to down at the primary care level said they felt very stressed and not prepared for dealing with some of the complex conditions such as dementia that they see. I think one of the biggest challenges that many countries in the region are facing is really what is the role and the mandate of each different stakeholder, and so the need to develop that governance system and identify the roles and how to work together across the different sectors. Next slide, please. And to do that, there really needs to be a way of really effectively coordinating across different government stakeholders and to build the systems to really incentivize that collaboration. It's very easy to put on paper, but how do you incentivize collaboration across these systems? Obviously, to take all of this forward, the financing is absolutely key, and this was highlighted in all countries. They need to start preparing now in terms of their financing systems to be able to provide that adequate coverage, to pool financial risk and drive incentives and for efficiency. In terms of the human resources, obviously the gaps in human resources are substantial. This is across the whole of the spectrum, from the care assistants, the nursing, to the allied health professionals, of which there are physios, the rehab specialists, etc. There's a whole range of jobs and job creation that are needed to push forward and ensure high quality care. But this is also a huge opportunity for developing a new care market, both domestically and internationally. And some of the countries in the region, Tonga specifically, were really looking at this role of care workers for international markets as well. Finally, already been highlighted, with families as the bedrock of care, as has been really highlighted in policy, there does need to be a much stronger emphasis on how to support family caregivers effectively. It was in Mongolia that we found that there was a cash transfer for family caregivers, but that was this training. There's really building up mutual support, of which we'll learn a little bit more about later, and of course to really be effective in providing that family support, increase the availability of home and community-based services that can support families. On the technology side, of course, there is the really need to increase the use of accessible and assisted devices to ensure that older people can maintain their independence for as long as possible. But really, there's an opportunity to maximize, the technology that is emerging in the region and globally on really facilitating the delivery of care. And hopefully that will be covered in the later discussion as well from Buddy Home Care as well. There's a huge opportunity for using technology to really restructure and implement and be integrated into the design of these systems as well. Lastly, and again, this is reflecting on Eduardo's comments, really important to recognise long-term care within the broader context of age-friendly communities and environments, and the interaction between how housing, transport, social protection and healthy ageing programmes. This can all be brought together, then we strengthen the systems and services around long-term care and strengthen the support for older persons collectively. And the final point that we would really like to highlight is, obviously this is such a rapidly emerging area with so much good practice coming, many of the common challenges to be across countries, so the importance of learning from regional and global best practices is going to be absolutely key, and that's why we're so happy to be here today to learn about some of the best practices in the region. Thank you very much.
Okay. Thank you, Meredith. Thank you for sharing this important work of ADB on aging and care. Supporting these developing member countries through capacity building, situation analysis, and strategic plan work. And so it's very important. And for highlighting the key set of challenges that need to be addressed, and also through this work of ADB, there's a good set of recommendations on how to building good care and support system for older people, which can be through different approaches, including this, maximizing the technologies, providing better support for family caregiver, including putting this long-term care efforts into a broader context of other developments, including age-friendly environments, and also the healthy aging program or other effort relating to social development or economic development in general. So thank you very much for your presentation. Now, I would like to move to the second presenter, Ms. Thuy Tran, the country director of Helpage International Vietnam. Ms. Thuy Tran has been working in the field of development for over 20 years, and in the past 10 years, she focused on the aging issue, and she's also the co-founder of Cultivate Intergenerational Self-Help Club, are the one that Dr. Duc mentioned in her opening remark, which this model promote healthy and active aging, and by using a community-driven development approach. And this is what she's going to share with us today: community service through intergenerational self-help club. Please meet to it.
Can you hear me?
Yes, yes.
Thank you.
Okay.
Good afternoon, everyone. Today, I'm very happy to be on behalf of HelpAge International in Vietnam to present to you the topic about the comprehensive community care services through intergenerational self-help clubs, or in short, it Issc in Vietnam. Sorry. Sorry, it's not moving. Okay. Yeah, so as Mr. Duc from Malaysia, Vietnam, I mentioned earlier, Vietnam is one of the fastest aging countries in the world, and it takes us only 25 years to transit from an aging to an aged society. So it's much faster than other countries. So if you look at this one, you can see that the structure of the Vietnam population by age groups in 2019, you can see that majority, the bigger part of the population now is in the age of from 30 to 50 or 55, meaning that in around like 20 or 30 years, this population will move to older population. So meaning that in like 10, 20, 30 years, Vietnam would have a very large older population. Yeah, currently we have around 12 million older people, 60 years old and above. And that will be close to 32 million by 2069. However, Vietnam is still a low middle income country, and we have very limited resources to properly respond to and take advantage of rapid aging. So getting old before getting rich has brought us the challenges how to meet the increasing and complex care needs now and in the future if there is no timely and effective solution. More specifically, if we look at the demand side, there is a growing number of older people with care needs. From the supply side, there is a reduction in informal caregivers. As you know, in Vietnam, women as a traditional carers now go out for work, and there is increase in migration of younger people to the big cities or abroad, either to study or to earn a living. In addition, the increase in non-communicable diseases, NCDs, has made the care needs more and more complex now and in the future. So how to fill in the growing care gap? First, we can decrease the care demand by promoting the disease prevention, promotion of health, self-care, and active aging. Second, we can increase the care supply by supporting the family caregivers and increase engagement of the care volunteers that Meredith in the early previous presentation already mentioned about that. And third, we should extend the long-term care services, particularly the community-based care. That's a type of care that the older people in Vietnam prefer most. Before we go into the intergenerational self-help clubs community-based care component, I would like to share quickly with you the Issc intergenerational model first, so that we can understand the model before we go to the care system of the club. So the Issc development model is a voluntary social organization established at the community, at the village level. And it is a development initiative that provides control of the development process, resources, and decision-making authority directly goes to community groups. The underlying assumption of Issc development model are that the community are the best judge of how their life will be improved. And if provide with adequate training, information, opportunities, and resources, they can organize themselves to provide for the immediate and long-term needs and development. And moreover, the Issc development model are motivated by their trust in people. And hence, it advocates for people's full participation and ownership as a powerful force of development. And by treating people as assets and partners in the development process, which will make the model more responsive to local demand and more inclusive and cost-effective compared to traditional model in Vietnam. And there is a standard Issc organizational structure which has been designed to promote the full local participation and ownership of the Issc model. A typical Issc has around 50 to 70 members and is established at village level. The club has majority of the members are older people, majority are women, and majority are socially or economically disadvantaged. And the Issc managed by a club management board, which comprised of 5 members, and it is elected every 2 years by its members, and at least 50% of the board members are women. The members are divided into the neighborhood groups. Each group has their own group leaders, and members are encouraged to form and participate in various groups that are under the club. Those groups can be named as social and cultural groups, physical exercise groups, sport group, home care volunteer groups, livelihood support groups, and others. And the club attracts both young and old, men and women, poor and non-poor, and it works well in rural, urban, or mountainous settings. Over the years, we are happy to see the number of Issc has rapidly grown throughout the country. For example, by the end of 2021, 3,842 Issc have been established in 61 out of 63 provinces and cities in the country. And with the Prime Minister Decision 1336, the country aims to increase the number of Issc to 6,500 by the end of 2025. And with the new target set in the National Program of Action on Older People, 2021-2030, at least 80% of the communes in the country would have Issc by 2030. So this is the very quick growth of the Issc in the coming years. And over the years, the Issc model has won many awards and recognition. For example, the model won the 2020 Grand Prize winner of Healthy Aging Prize for Asian Innovation. The prize is an initiative of the Economic Research Institute for ASEAN and East Asia area, and the Japan Center for International Exchange, GC, carried out under the auspices of the Japanese government Asia Health and Wellbeing Initiative, ACWIN. And the Issc also selected as best practice for promotion of healthy aging in 6 WHO publications, and is also selected as a best practice in achieving SDG by UNDESA, and was selected as a best practice in promotion of healthy and active aging in World Bank and JICA publication, and many other publications as well. So normally the Issc would have at least 8 core components of activities, which based on the top needs of its member and communities. And these components are, you can see here is a social control, people singing, dancing, together, have fun together. And second is the food and income security. Third is healthy and active aging. Fourth is community-based care. Fifth is self-help and community support. And sixth is lifelong learning. And seventh is the right and entitlements. And the last one is the resource mobilization to ensure the technical and financial sustainability of the club. However, today I will just focus on the Issc comprehensive community-based care services. So the Issc community-based care services include 4 components, of which the Issc are directly responsible for social and personal care and living support services through their home care volunteers and the Issc members and the communities support. While the healthcare, the 4th component, is provided by the local government healthcare providers, thanks to the partnership or the linkage between the Issc, local association of the elderly, and the healthcare providers. And this is the care management scheme of the typical Issc. In the club management board, which I said earlier, consisting of 5 members, there is 1 member who is in charge of care, and here we call it a care manager. And each Issc has from 5 to 10 home care volunteers to provide social and personal care services. And each home care volunteer provide at least 2 home visits per week to the care client. And for living support services, the Issc will work with the Issc members, community members, and the other stakeholders, including local authority, to provide various support needed. And for healthcare, the Issc link with the local government care stations to provide the services based on the needs of the care client. And the typical Issc normally provides community-based care services for around 4 to 5 home care clients. So you can see that the more Issc, the more the care client will be taken care or supported by Issc in collaboration with other stakeholders. So who are the Issc home care volunteers? It can be anyone, young or old, rich or poor, man or woman, who willing to help others. And from our experience, the age of the home care volunteers mainly from 50 to 70. So it's a near old and young old. And this group, now as I mentioned earlier, is a increasing population groups in the country. And if we can utilize these resources, we can help the human resources for the care. And the volunteers is anyone, but normally they are also the Issc members, so they can help receive the benefit as a club member. And they should live close to the care client so that they can help timely. And once we identify the home care client and once we identify the home care volunteers, then we will match them together and provide training for the home care volunteers. And what does the Issc home care volunteers do? Normally they provide social and personal care. For social care, there are some examples like befriending, talking, singing, reading book, poetry, something like that, and provide communication and informal support, or provide escort service like helping the older people to go to market, clinics or market and temple or others. For personal care, there are some examples like doing errands, washing clothes, and house repairings and farming, or support simple healthcare and basic health information if they are capable, and do some personal care. And they also keep record of their service monthly and report to the Issc in the Issc monthly meeting. To help you visualize the work of the Issc community-based care services, here are some samples through the photos. You can see more. That is actual activities of the home care volunteers. Like they help with the cooking, taking meal, personal grooming, fun, escorting. and some other simple rehab. Massage.
But you may have to
yeah,
rush a bit. Thank you.
Yeah. Yeah. And what the ISSC can help in terms of the living support, they can support like in cash, in kind, and labor support, and access to assistive devices, and access to right and entitlement as well. They mobilize the resources from the communities to help the care client. And here is our 3 key lessons learned. First, ISSC can contribute greatly to addressing the unmet and increasing community care needs, especially in low and middle income countries, if they are included. Second, systematic link between the ISSC and local health and social care system is important to ensure the care quality and sustainability. And third, investing in ISSC to provide community-based care services is cost-effective and affordable and relevant for low and middle income countries. Thank you very much.
Thank you, Thuy, for this very good presentation, very comprehensive, and sharing with us how this IHSC with this community-driven development approach, what it actually looked like in practice, and how it worked in terms of providing care and support for older people who are in need of care. And actually, we know that this kind of community-based organization of older people, they can actually do more than only providing care and support. But for today, the presentation focusing on this. And thank you very much. So, and I'm now would like to introduce our last speaker, the last presentation, and Mr. Janvit Wisosongkram. He is the Deputy Director of the Foundation for Older Person Development. He is also the co-founder of the Social Enterprise Initiative to provide home care for older people. And before entering this non-profit development sector, he worked in the business sector, and he brought with him experience that helped the foundation to develop a successful social enterprise company that he will share with us today. So yeah, he will be sharing with us this Buddy Home Care Initiative, the social enterprise on home care for older people in Thailand. Over to you, Kun Janvit.
Okay, thank you, Kun Sa. So can you hear me clearly?
Yes.
Okay. Good afternoon and Sawadee Krap for everybody. So actually for Vietnam, Miss Thuy already sharing a lot of experience of the community-based long-term care. So it's easy for me to skip that scheme and then shipping up or the upgrade your program into the social enterprise way. I would like to share the social enterprise initiative of home care for older people in Thailand by FOPDEF. So this is the brief information or the situation of the older people situation in Thailand. We have 66 million population, and 18% already is were the older people. Let's say it's 12 million people, and 19% is the homebound, and also 2% of them are the bedridden. So this group in total is 21% need care. And also for the family shrinking, you can see that there are a lot of people living alone, 12% of the older people living alone, and 21% of them living with spouse. So for the conceptual framework of long-term care in Thailand, so we divide the aging into 2 groups for simple. One is the active. So the active one is a large group of the older people is more than almost 80%. But in fact, the dependency also still existing there. So we have like the care workforce from the family member, volunteer, and also like the community-based long-term care as in Vietnam. And even the active or dependency, if they are like not worst case of the like mobility or disability, they still living at home. So that means the idea of community-based long-term care in Thailand try to make them like a living at home longer or aging in place. So we provide the age-friendly environment, health literacy, and also like the health promotion. Okay, and the idea of the like quality life is not just only add year to life, but it should be like make the appropriate ratio of the health span and also like the lifespan. So you can see if they live with the healthy aging longer, it's more like a good quality of life, and like no need to spend a lot of money on the like disease state and also a terminal state. So it will be good that if we like shipping up our like community-based long-term care to run as the business and earn from this stage and use the profit from this stage back to like encourage the community-based long-term care to do the health promotion. So this is the idea of FOPDEP to like test run about our idea. So measure the financial for the long-term care is from the government revenue, but the non-profit or charity and also the CSO and CBO also like contribute to the care workforce in the community level. So we can also like have the option that including the private sector to join force for the long-term care stakeholder. And nowadays, the family and also the older people themselves is the one who like pay for the financial for the like long-term care for their like daily life. So FOPDEP used to work on the left-hand side as a non-profit organization, and we try to like have the new idea of the buddy home care on the right-hand side of the private sector perspective. The social enterprise is like the idea in between of the traditional business and also the traditional charity. But nowadays you can see that the traditional business also have the project scheme like corporate social responsibility or the CSR, and the non-profit also like come up with the income generating activity for the financial sustainability. So this is the simple idea of the buddy home care. We provide the opportunity for the disadvantaged minority youth to training to become the caregiver. So this can help them to like break through the poverty cycle. And then we provide the professional care for the customer to earn like a revenue and give back to the society by do offer the basic health check and also like a training through the community-based healthcare scheme. So this also like a link to the social sustainability development goal. So the impact of our social enterprise from 2017 to 2021, we already trained like 65 disadvantaged youth and provide care support for average like 80 customer per year, and we can use this profit to like continue to serve the disadvantaged older person in number of 600 since 2017 by no need like any financial support from the like institution donor. So we already like spend 3.2 million for like fully subsidized for scholarship for the children, and we also like paid for hiring to work at the salary around like 9.3 million baht, and we provide like a community-based care. We use the revenue from the business around 2.5 million from revenue and also the public donation to spend for the community-based long-term care activity. And we have opportunity to conduct the social return on investment report that proves every 1 baht you invest on the social enterprise like Buddy Home Care, it will return like a 5.10 baht. So that means the ratio of the return is very high for my perspective. And also like the Buddy Home Care also recognize and get the award from Happy Grand Prize winner in the technology category. And also we won the program television in Thailand called Win Win War Season 2 that we get reward like 2 million baht from the television program that competitive on the business model that help the society. And I would like to conclusion that experience of FOPDEP since 2005 that we run the community-based home care program until now it's already like 15 years. But we try to start the social enterprise scheme since 2008, and it like starting on the 2012 as the program. And nowadays the ecosystem of the social enterprise in this region, I think is not the new story. Think about your program that already run very good practice on the community-based long-term care in the community can upgrade or shifting up into the social enterprise that you can stand by your feet, you can like financial sustain by yourself and also contribute to the society. And nowadays we have a lot of partners to join force as the social enterprise. Thank you.
Okay. Thank you very much, Kun Janet, for sharing this experience of the foundation for that in terms of you developing this social enterprise to provide home care for older people, provide paid home care, because it's actually business. And this initiative is building on the experience of the foundation in terms of providing a whole community-based care, and currently there's a good indication that it will be financially sustainable in the future, which is this is one of the key challenges of development program, the financial sustainability. And there is also, apart from running on its own to be able to support themselves, they can also provide support for other older people in the poor community through this program as well. So thank you very much. And I think this could be an example for people who would like to, turn the not-for-profit or this traditional home-based care, community care into a business using this social enterprise approach. So we have about 10 minutes for Q&A and any comment. And I in the chat box we have one question already, but for those who would like to ask question or any comments, you can raise your hand using the function, the raise hand function on the screen, and it also put your question in the chat box. We have about 10 minutes for this. The question from Dr. Thawon, Thailand. This is direct to Thui. About the Issc, is there a cost study of the Issc, especially for personal care ADL activities? It seems like Dr. Thawon would like to use it to estimate the cost projection for compulsory community-based long-term care program in Vietnam. He probably have some initiative or under work there. And tweet, please. And for others, if you would like to have a comment or question, put in the chat box or raise your hand. And we cannot hear you, tweet.
You hear me now?
No.
Yes.
No. Yes. In Vietnam, we just have the cost study of the Issc as a model. It's not it's not as a whole model. It's not only the personal care ADL activities yet. So for the Issc as a whole, the cost is around $5,000 US dollar to $10,000 US dollar. It depends on it's already included on the staff cost to provide technical support, training, and also the grant that goes directly to the Issc. And also it depends on the focus of the Issc in that area. They want to focus more on the healthy aging, or they want to focus more on the livelihood. So the cost per Issc might be different. And also, it also depends on the number of the Issc as economies of scale. If in one project, there are more Issc, then the cost per Issc go down. But if less Issc, and then the cost goes up. So your question is also very important for us for the future to have some cost study on that personal care ADL. And that if we have that opportunities for the study, we will share with you. Thank you.
Thank you. Thank you for your response. We have one hand raised, Gemma, and also we have one question in the chat box. I would go with Gemma first, and then followed by the question in the chat box.
Hi everyone, that was really exciting. And I have a question for both Vietnam and Thailand. Are there any measures from the government in terms of, you know, helping the aging in terms of supported care? That's all, thanks.
So you want to go first?
You know, any examples from both countries, Vietnam and Thailand, in regards to supported care or, you know, supported housing for the elderly in those countries? If there's any initiative from the government, aside from, you know, the community base that we've heard from Vietnam and Home Buddy from Thailand. So I'm just wondering, from the government side, is there anything from the government? Thank you.
Thank you for the question.
Sir, I can go first.
Yes.
Yeah. Thank you. Apart from supporting the intergenerational self-help clubs as a national policy, the government also approved the national program on healthcare for older people. It is a separate program, and the government allocate a budget for that program. And the Ministry of Health work very closely with the Association of the Elderly and also the private sectors to pull down all the resources, the government budget, community budget, and also the support from the private sector to take better care of the older people in Vietnam. Yeah, that is, yeah.
Thank you. We have 4 minutes. Jane, if you can go quickly on this question, and then we follow by another question in the chat box, and we may or may not be able to take Dr. Vinod. Please, Jane. Unmute, please.
Okay, thank you for your question. For the government, they also provide a local health fund for financing the scheme. In the past, they've also work with the community base to develop the proposal in the local level, and then run the community-based home care. And also in Thailand, we have the universal coverage scheme, people can access to the a hospital, and also the home care-based long-term care program. So they have a lot of scheme in the government side. But yeah, for the NGO and also the body home care, we try to fill the gap that the government unable to meet the need of the people in the community level. And for the social enterprise nowadays, government also have I'm not very sure the law that support for the social enterprise that we don't need to spend the tax. It's a tax free for the social enterprise, and also for the initiative, the government also have provide the opportunity for a startup to use the new mechanism of chain rather than the old-fashioned way. Thank you.
Okay, thank you. And I think we can go for the last 2. The question in terms of more information about this program in Thailand on body home care, our communication will put the link to the information that, and you can contact us if you would like to have more information on the body home care. So I would like to have the last few minutes for Dr. Vinod, and this will be the last question. Thank you. Please go ahead.
Thank you very much. It's really a wonderful work done by all these organizations, and especially Issc. I just wanted to know, how do they approach to the rural and remote areas in the villages through such programs? Because in India, it's very difficult. Our population is more than 140 millions. Out of that, 71% they stay in rural areas. Out of that, 50% are in remote places. So what do they do in their countries for the remote areas?
Okay. Yes, Thuy, please. We have only 1 minute. We have to really stick to the time. Please go.
Thank you for the question. The same in Vietnam, we have about 65% of older people living in the rural areas. And we also found out that it's more challenging to operate the Issc in the remote areas. However, in Vietnam, we have the government aside the Association of the Elderly to take lead to work with other sectors like health and social sectors to support the Issc and the Association of the Elderly. They have the network everywhere, no matter it's a rural or remote. And also, it is a community-based model. So the community are everywhere, and they have their own resources. And what we can do is just create the enabling environment and support with initial, a technical support, so that they can know how to operate, how to manage, and then they can use the communities' own resources to run the club. Thank you.
Thank you very much, Thuy. And before just a few words to close the session, may I ask FOBDEP staff to put the link in the chat box for the information on body home care. Yeah, there's a few requests to know more about this, but we don't have time to go into it. Yeah, so in closing, and on behalf of the organizer, I would like to thank all the speaker and presenter and the participant for your contribution. I think we learned a lot from the presentation and question from all of us. And I hope this session, this sharing, will benefit your work and contribute to the implementation of the MIPAA, especially those key challenges addressed during the IGM today. And also, during the presentation of the key stakeholder in the morning. And so thank you very much for your contribution and for joining us today. Have a good day. Bye-bye.
Thank you, Kun-Nusa.
Thank you. Thank you. I apologize. We just cannot extend the time because it's been
Thank you, Usa.
Thank you.